I'd like to call to order the Health and Human Service Committee meeting of October 10th. If we could all please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, moving on to item 3, can I please get a motion to adopt the agenda?
Support.
Got a motion and support. All in favor, say aye. 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 Any opposed? Thank you. And now we'll move on to public participation. This is the first opportunity for public participation for those who wish to speak for a maximum of 3 minutes on any of today's agenda items. There is a second opportunity for public participation at the end of the meeting, which you can speak on any issue. Anyone? All right, seeing no one, we'll close public participation. And we're going to move on to number 5, department recommendations. We're going to start with item A. Can I get a motion to recommend to full board a budget amendment for fiscal year 2025 for MDHHS CPBC?
Support, Van Sickle.
All right. Anyone have any questions? All right, seeing none, can I get a motion to, or wait, can we, all in favor?
Aye.
No, we're not.
You're not voting electronically?
Any opposed?
Motion passes 9-0.
All right. We'll move on to item B, a contract with Aquasight water waste monitoring for COVID-19 in the amount of $1,197,271. And Andrew is not here. Can I get a motion to recommend a full board?
Andrew is here.
Oh, he is. Just in time. All right. How are you today?
Good afternoon, Commissioners.
Good.
Thank you. Today I have in front of you 2 items. The first, and they are connected to the same project. The project is the wastewater surveillance project. If any of you are aware, really since the beginning of COVID, Public Works has been testing our sewage network, and with the help of a contractor called Aquasight. And what this is it's a surveillance project that they were looking for pathogens in the wastewater. The hope is that we could do early detection for this project so that we would get early education and early notice out to communities that if we saw certain pathogens, and they have a varied amount of abilities to test pathogens in the wastewater. So it is a early warning detection system that was started, and now it has come to the point where Public Works thought it would be best to hand it over to the Health Department. And so what we have in front of you is first the amendment in item A and the amount of $304,000. This would cover just this period of time in 2024 to get us to the new fiscal year, new calendar year, in which we would get additional grant dollars to totally support all the wastewater testing. The other item, item B, is actually the contract with Aquasight. This has been a longstanding contract. It truly is a sole source with Aquasight because they've built a dashboard monitoring system just for Macomb County specific data and information that we have. And so it truly is a sole source for that reason. I'd be happy to answer any questions, Commissioner.
Thank you. Commissioner Van Sickle.
Thank you. Good afternoon. Does this detect anything other than COVID?
Yes, so you can, it has the ability of detecting things like polio, influenza, basically anything that we have the ability to test for, which is a myriad of different pathogens. We have that ability to test, and we are testing those things.
Okay, thank you. Thank you, Chair.
Commissioner.
You're welcome. Commissioner Brown.
Can we see a map of all the locations? You probably got it on a spreadsheet somewhere, all the testing locations across the county.
Yeah, absolutely, Commissioner, we can provide that.
I mean, because there's also, we do test for water quality among other things. Will this also include that testing?
So it's a different type of test, water, yeah, it's a little bit different,
So they'll be doing a separate, they'll just be doing.
correct.
Health
And also there's, there's different protocols when you're testing sewage in the sewage system compared to surface water, that, in terms of protection. So our staff are able and do the testing for water quality. These contractors are specifically trained to go into the sewage system and manhole covers and have the proper PPE and protections they have that capability. So it is a little bit different types of equipment.
Are they gonna do the DNA tracking?
So this is not quite DNA tracking for the wastewater. It is pathogen testing. So it is looking at the DNA, but it's more from the standpoint of not necessarily human or animal. It's really looking at identifying what that pathogen or that virus is, so that we can detect actually what is in our wastewater and what are we seeing.
There's a lot of things to test for in the wastewater. So, okay. All right, thank you, Mr. Chairman. Thank you,
Commissioner
Madam Chairman, rather.
You're welcome. Commissioner Gannon.
Thank you. Good afternoon.
Good
All
afternoon.
right, so I'm familiar with this, obviously, been through this already, where I was previously. So how many sites are you going to test and and how many months are you going to do this for? 12 months?
Yeah, so
Going
it's
to
all
do the testing once a month?
correct. So it's once a month and it's all year testing. We're able to do that because it is the sewage system as opposed to surface water. We have to stop that, obviously when the weather prevents us to do that testing, sometimes it ices up. But because this is sewage, we'd be doing that testing all year round. And we can get the map and all the sites for you as well, Commissioner.
It was helpful for us during COVID to test, like we have the Martha T. Berry site. We tested our own sites down in Warren on a more like a once a week or once every other week scale, because then you can see what COVID's coming out of there, because they're the most impactful people that might die from it, elderly. So
agree.
you ever think about maybe testing near those types of homes,
Yeah. Yeah.
more often maybe, and less in the non-populated areas, but more in those areas?
Yeah, you bring up a really great point, and we call those congregate care, and that really encompasses not only nursing homes, but we're concerned about, correctional facilities,
Correct.
Adult daycare type facilities, any of those where we have high-risk individuals that we really need to look out for. And obviously during COVID, some of those facilities had high cases and high numbers and vulnerable individuals. So you're absolutely right. We're always looking at ways that we can make this better and improve the number of sites that we test, and then also, increase that frequency while also balancing our budget of what dollars we do have as well. So we get the most bang for our buck, but we're definitely open to looking at that. We have been, but I'd be happy to look at, discuss with you further if you had some suggestions as well.
Yeah, I think that would be helpful. I mean, obviously, when you see the trend going in the wrong direction, and then you can maybe, go do some testing inside the facilities, have them do testing, find out who's infected, and then you can get to them faster before there's a tragedy.
Absolutely, absolutely. And this has been very effective at looking at, especially as we see new pathogens coming down the pike, we can start testing for those to see if they're in fact reached Macomb County sometimes even earlier than traditional testing after the fact that we would do in a lab. So that's the value of the wastewater surveillance project, is that it's truly, we can get results earlier and maybe save some people ahead of time, which is why we're supporting this project, and I think we need to continue it.
All right, thank you.
Thanks, Commissioner.
Commissioner Zinner.
Thank you, Chair. I may have missed this, and I'm sorry if I'm being redundant. Are you testing the water coming from Port Huron? And as far as that is near Macomb County, because we have, Macomb County stretches quite a ways. Are you going to that area too close?
So I don't believe we currently are testing Port Huron waste. Is that what you were
Yes,
asking?
yes.
No. Right now, these are interceptors, the interceptor systems that are only capturing some of Macomb County. It is not the whole county either. But these are major interceptors that are looking at large populations within Macomb. We do have a few sites. We were doing some testing outside the New Haven jail, the state facility there, as well as Martha T. Berry, because those were specific sites that we felt really that we had to, that we wanted to monitor and test because of the high risk, of pathogens spreading very rapidly in there. And so, as Commissioner Gannon did mention as well, would we like to have more sites like that? Absolutely. But we would also need to have the overall, interceptors that capture a big part of the population as well, some of our neighborhoods. So right now it's just Macomb County sites.
Are you testing for cancer during this, or not going into that area?
I don't believe cancer is one of those that we can detect at this time. Hopefully, there's advances in this wastewater surveillance technology just in the last few years. I mean, we're talking literally the last 3 years. There's been quite a lot of advances in this. This is a system that, we really led the way in Macomb County with this wastewater surveillance project. And a lot of, kudos out to the individuals that set this up. A lot of work goes into this. But I wouldn't be surprised to see some of those other pathogens down the way be able to be tested, but cancer is not currently one of those, unfortunately.
Thank you, and thank you, Chair.
I have a quick question. So do you know approximately how many locations you are testing right now?
I will get that to you, Commissioner,
Okay.
for sure, along with that map.
Commissioner Brown?
Each pathogen you test for, that's a fee associated, does that drive the cost?
It does. So that's why we have to weigh out what is the value of that pathogen that we test, when we do the testing, in terms of, is it something that's, we are currently seeing, are we seeing a lot of it? Is it seasonal, so we can use a seasonal detection on it as well? So there are additional fees. The more things you test for, that cost does go up.
So what do you do with the information once you have it? So all of a sudden you find a cluster, because it's past tense, right? I mean, it's showing who was sick.
It is somewhat past tense, but it is pretty rapid in the sense that when they test it, it is less than 24 hours when we get that result, because it is PCR based. So you're actually talking hours of results, and we can actually step in. What we're looking for is if there's...
Who analyzed the data within 24 hours?
So Aquasight puts it together, and we get the information. The health department gets the information in a dashboard format. And so with trend information, you can kind of tell if this is just, you're always going to have some baseline data of like constant numbers, but obviously if you see a really rapid change, we've got something going on there. There's something here. So then we can follow up with that facility or that area to find out, drill down in that data more to see what can we do? What should we do? Is it education about how to stop this pathogen specifically, hand washing, hygiene, different other types of, maybe we have vaccines that we can deploy, that we can do mobile vaccination clinics. Those are the types of things that we're looking at, the public health interventions to stop the spread, basically.
Because that's the reason we're doing it.
Right.
So how many employees do we have in your department that's going to be involved with interacting with this group?
So it would probably be approximately 5 employees.
Will that be less than the number that we're now currently using to do the testing?
So we aren't doing, none of our staff are doing the testing right now. Right now, we are simply looking at the data so Public Works has the contract with Aquasight. Aquasight is doing the
So
testing.
you don't know how many people, all right. How do we know that the information's accurate? How do you check? Because you're relying on this test, but how do we
Sure.
know the information's
So there's
accurate? So we're
laboratory-
getting a value, so we're not being played.
There's a lot of laboratory standards in place that they have to go through rigorous testing to make sure their processes are in line with standards and accurate. So there's a lot of things in place for a laboratory, and that's the reason why we use accredited labs. compared to non-accredited labs because they have that accreditation that they have been certified, their equipment is up to date, it's calibrated, it's accurate, and that's why we use those reputable sources, those labs that are accredited.
Who checks them?
It's a national organization. These are national organizations that they're accrediting of these laboratory.
Thank you.
Commissioner Nard.
Hi, Andrew. I don't really have a question. I just, when I noticed this was on on our agenda today, I was excited because I know people that do body removal for Macomb, Oakland, and Wayne counties, and they were saying the high number of bodies that they're noticing that they're getting, where they even have to use different facilities far away from, where they normally pick up at. And so and they were noticing that the bodies didn't say it was COVID. They didn't really know why they were getting so many bodies. So when I saw this, that they were going to be testing for water and things like that, I was kind of excited. I just wanted to mention that. I'm glad that you all are on top of that and before something comes up.
Thanks,
So,
Commissioner.
thank you for that.
Commissioner Van Sickle.
Thank you. So Andrew, let me get this straight. There is no electronics or sensor package that you install at these test sites. Correct?
Correct.
We have an employee drive over to the test site, collect a sample by opening a hatch or a manhole cover or something and dipping into what's going by. And then that sample is brought back to
The lab.
the our central site, and then is it shipped to the lab?
Correct. So it's actually Aquasight. Their staff are the ones testing.
But they're not at our facility, so they're someplace else. So we have to ship it to them.
Correct. We currently do not have a lab, so we don't have a lab in-house for the
Okay,
county.
so from the time you say, okay, Joe, go get a sample, to the time the results come back, I assume electronically from the Aqua Lab, how long is that?
So, to run the sample, I can't speak to how long does it take, logistically from the time they grab the sample to get back, submit it to the lab. But once the lab receives it and runs it, it's typically 4 hours before you get the result. And that is all digitally integrated. So they get that result immediately, feeds into the data platform that they've built and that dashboard. And so whenever we log into that, we'll get a notification that there's been updated results, basically, and that we can check the dashboard.
But it's a day or two from the time the sample's collected until the time the lab gets it, it sounds like.
No, it's
Is
less
the
than.
lab local someplace, or?
It is.
Okay.
So that time frame, because of the pathogens, you want to get that sample immediately there. And so that sample is within hours of being collected to the lab, and then it's run immediately. So it's the same day.
Do we have a delivery service drive it over, or?
Aquasight handles all that.
Okay, so they come and fetch it.
Correct.
Okay, thank you. Thank you, Chair.
You're welcome.
So just for clarification, is it one of your employees or is it Aquasight that's actually getting the sample?
Aquasight is the one that's collecting the sample.
Just wanted to clarify it. So
The
they
only
collect
thing
the
my-
sample and then they take it to their lab, they test it, and then they email you the results.
Correct.
Okay,
The only
perfect.
involvement with county staff is actually looking at the data, interpreting the data that Aquasight produces for us. I hope that maybe
Yes,
makes it a little bit more
Yes.
clear.
yes. Commissioner Grott.
Hello, Andrew.
Hi, Commissioner.
Quick question. Is the state requiring us to do those tests?
It is not a requirement.
Okay, thank you.
You're welcome.
All right. Anyone else? All right, seeing none, can all those in favor say aye?
Aye.
Any opposed?
Motion passes 12-0.
All right, thank you.
Thank you, Commissioner.
Now we're going to move on to item 6, budget reviews. Motion to receive and file budget reviews for community mental health and substance abuse.
Motion.
Support by Nard.
Who made the motion? I'm sorry.
Yeah.
I did.
Okay. Motion and support. All right. Hi, guys. How are you?
Good,
Good.
Good afternoon, Commissioners. My name is Tracy Smith. I'm the CEO for Macomb County Community Mental Health. I just wanted to take a second to introduce myself and make myself available as you have questions. And these more than capable gentlemen are going to do the presentation.
Good afternoon, Commissioners. Ken Melvin, Deputy CFO at the Community Mental Health.
Good afternoon, Tony Gaglier. I'm the Finance Director at Macomb County Community Mental Health.
I'll start kicking us off here. Should have budget details in front of you for both mental health and substance use fund. I'm going to give some high-level thoughts about where we are statewide. As we all know, the public health emergency ended. That would be May of 23 at this point. We've been evaluating the unwinding of the public health emergency since then. As a reminder, our Medicaid revenue is largely, actually all tied to the number of eligible folks that we have in the county that are on Medicaid, not just who receive services from CMH, but everyone who's Medicaid eligible. During the pandemic, everyone remained Medicaid eligible during that time. There was no redeterminations, as they call them. So at this point, we fully recognized the 12-month wind down after the public health emergency. So this past summer, actually in August of 24, we kind of saw what we think is where our eligibles are going to level off for revenue. We've been working with the state during this entire transition to make sure that the revenue is sufficient as eligibles go down, that our revenue is in place to keep services to the folks in the county. So at the time of this budget preparation, as far as our Medicaid revenues go, we had some tentative, I'll call them assumptions from the state about what we could plan for. We took those in percentage increases per population. For instance, our disabled and blind population, our temporary assistance for needy families population, and applied those rates to those in the aggregate. We did not have the detailed breakdown that the state gives us until after the budget presentation was done. That being said, we don't feel that having the detailed rate information changes these assumptions in any significant way, but I wanted to highlight that here. So we are seeing a revenue increase over what we expected in 24. The state continues to put money into the system. Just recently, statewide, they've added another roughly $41 million into the statewide system. Obviously, we'll be a beneficiary of a portion of that. So you'll see a large increase in our charges for services in the mental health fund as it pertains to that. We are seeing a decrease in investment income. The reason for that being is we cost settle with the state. Those cost settlements are on a delay. So ultimately, we, for lack of a better term, hold a lot of the state's money until they ask to settle with us, and we are able to earn interest on those dollars. The settlements were very high during the pandemic, so those liabilities are rolling off our books and the cash as a result. So our investment income is going down, but that was to be expected. But I wanted to highlight there because there's a big change in the community mental health fund as it pertains to that. In the SUD fund, you can see that our intergovernmental revenues are going down from our 24 to 25 budget. That intergovernmental revenue is largely tied to grants because a lot of dollars were into the system through ARPA and other things. During the pandemic, those grants are going away, so that revenue is going down, and we expect that to level off as well. But those are kind of the high-level thoughts that we have with revenue. So I'm going to hand it over to Tony to talk about our expense assumptions a little bit.
Okay, thank you. So with that understanding of revenue, our goal on the expense side is to understand the needs of our community and how we're going to deliver those services. And we have what we call direct run services, which are staff that are employed by the county. And we also have a very vast provider network, which is the bulk of our costs that you'll see on the line that says contract services. So as we understand our revenue, we work real closely, of course, with our employees to identify where do we have needs for staffing and to provide the services that we need. And we work very closely with all of our providers, which we have hundreds of them, to understand the cost pressures and some of the needs that they have in order to have an adequate network to deliver our services. We know as we're all felt, their pressures are around staffing, turnover, and just the overall inflation costs. So as we prepared this budget, as we understood the revenue cost, we worked as closely as we could. I'm going to start with the contract services on the provider side to give increases where we could, ensuring a stable budget that balances, but at the same time, trying to address some of the needs of the network. So we went through, analyzed all of our service lines, and increased our rates that we're going to be then paying out to the network. So the increase that you're seeing is the result of that analysis and our ability to provide more funding to all of our various providers. On the employed side and on the personnel side, the way we approach that is based on our manning table, our FTEs. Our goal is to fully staff for all of our positions because most of those are staff that are providing care to our consumers. As you know, it's a challenge to keep full staff and to manage turnover. The way we approach the budget, though, is to fully fund each of those positions, even if they're vacant, with all of the fringe benefits. So there is an opportunity there as we currently and usually consistently have a 50 to 70 FTE vacancy factor. There is some opportunity for savings there, but from a budget perspective, we wanted to ensure that the budget had the funds to allow us to hire and staff all the way up to the needs that we have in our FTE base. So those are the two main costs that you'll see on our budget. The others are, supplies and services and the related support cost. All of those went up just from an inflationary factor. I believe we built in a 3% inflation factor. That's mostly what's driving that. And maybe some changes in services, but the two really being how we approach personnel and then, of course, our provider network. And then we would have taken the same approach on the SUD side. So same thing on staffing for the personnel. And then you'll see a slight decrease on the contract services. That directly relates to some of the changes that Ken spoke to on grant funding. If we're not receiving certain grant funds, obviously there's a corresponding service that's related to that, so that went down slightly. And then going into the projected years, we just took our expenses with a 3% inflation factor, and that's what's going into the 26 and the 27 expense structure. So I'll pause there if there are questions.
I do have one question really quick. So how is your staffing levels when it comes to community mental health overall? I know you contract with a lot of agencies, but even in general, like their staffing levels.
So in terms of maybe vacancies, typically we run 50 to 70, and it varies. There's turnover in a number of our positions, but at any given time, I could tell you we have at least 50 open positions that we're actively trying to recruit for.
Okay. Commissioner Van Sickle.
Thank you. Good afternoon. Did I understand that a number of, do you call them clients?
Or consumers.
Or
Person served, yeah.
Person served, yeah.
Persons,
Served.
I'm sorry.
Served. Person
Persons
served.
served.
Person served, thank you. So if I understood right, the number of persons served in the past years were higher and then came down to what you think is going to be a level in August, this August a couple months ago, that's going to continue on?
So our number of persons served has actually gone up. If anything, during the pandemic, we've seen a higher need for our services. What's gone down is the number of total Medicaid eligibles in the county. Okay. So they could be people that they don't have any mental health issues at all, but we get a capitated payment from the state for them. And because of the PHE, and if someone was on Medicaid, but they might have went out and got a really good job, hopefully, or so they're no longer Medicaid eligible. They would kind of come off of that payment roll, if you will. So no, we've seen our services go up. Costs have gone up. That's why we've been advocating so aggressively with the state about funding at the level that we need.
Okay, well, your contract services takes a big, it's granted it's 2025, but takes a big jump from 2024 to 2025. And then it's like less than half of that for the next couple years out. Why do you anticipate such a big jump into 2025?
Sure, I'll start, and Ken, if I miss something.
And then lower, and then much lower?
Yeah, so going into 24 and to 25, there are a few things that were happening that rolled into the 25 budget. Throughout the year, we pushed through some rate increases. So we did receive some funding from the state for those. We passed that on to our provider network. There were also things such as the direct care worker increases that came down from the state, so we had those costs. Many of those happened throughout the year, increasing our contracted services and then rolled into the 25 budget for a full year expense. So that's part of it, is we didn't have some of those expenses in the earlier part of the year. We have a full load in the 25 budget. The other is as I mentioned earlier, we did a very detailed analysis of our provider network and made adjustments to the tune of almost $20 million of additional funding that's going to go into our provider network. That's reflected in the 25 budget. And then for those that we didn't think warranted a targeted increase, for all our other services, we pushed in another 3% inflation factor. So there are a number of things that are leading in this. The most significant one that it would be that analysis and that $20 million investment in our provider network.
So,
And then, I'm sorry, for the latter part of your question is then going into 28 and to 27, at the moment, we just factored in a 3% increase.
okay. So the person served are people who require some kind of mental health services.
Or substance use, or they have a developmental disability. And then even take it even a step further, under our CCBHC program, which has really been big for us, we're serving a new, I'll call it a new group of people that have mild to moderate mental health issues, where in the past we wouldn't have. So that was an increase in services as well.
That might be where I was just going to go with my next question is, I would rather treat people and keep them out of a mental health crisis than try to treat them after they're in the mental health crisis. Is this what this moderate group is about?
It can be, for sure, so that whatever that illness is doesn't progress. But also if anyone who wasn't in severely mentally ill or substance use wanted to come see one of our therapists, for instance, and they deal with whatever everyone else does on a daily basis, they can now come see us, where in the past that wouldn't have been the case.
How are you advertising that service?
I think I saw a billboard on Howell Road. Tracy can speak to that for sure, but
So
I
we
know
have
I
a
saw one out
communication
there.
plan that we're happy to share with you guys, but we do have an active social media. And we also do have billboards. We do have radio and television that we've also communicated. And we approach it from to your point, someone who's experiencing a crisis, we're here for you. But someone who's just, needs, I'm struggling and I need some help, we're also here for you. And we have one central kind of intake or one central point that they can enter, and we're going to quickly help you figure out where the best place for you to go is.
Don't take this the wrong way, but I would rather spend our money putting you out of business,
We would too.
if you understand.
We would too.
Thank you. Thank you. Thank you, Chair.
Is there presently a waiting list for services?
So in with our charges for services, one of our smaller funding sources is our general fund. And when I say general fund, that's not the county general fund, but the state's general fund. So they allocate us roughly $7.5 million per year. And the goal of those funds is to help provide services to people who are no insurance or underinsured. So those funds, it kind of ties into what I was saying earlier, is people come off the Medicaid rolls, then providing that service would then fall under the general fund if they didn't have private insurance.
Okay.
Those funds are becoming extremely limited. We are currently spending more than our allocation, which is okay from a service perspective, because we didn't want to cut folks off from their service, but we are evaluating how we need to target those services and make sure that we're not spending more than we're allocating those funds. So there could be a wait list as it pertains specifically to that
Okay.
uninsured, underinsured group, but.
All right. Commissioner Hall,
May I add to that?
Yeah, go ahead.
So in addition to that, we do a network adequacy analysis to know where our needs are. And this year, and we've been doing it now for a couple of months, we are actively doing requests for proposals to build up our provider network, bring in more providers to ensure that we're serving as many people and limiting those instances of having to wait for services.
All right, thank you. Commissioner Hall?
Thank you, Chair. First, let me say I think you are doing a phenomenal job. Bill Kraft and Antoinette know every chance I get, I praise what you are trying to accomplish in today's society. It's an uphill task and a monumental job. But the two questions, the two areas that you hit on were the two I was going to ask the questions about. One that Commissioner Van Sickle asked on contract services. It looked like there was a pattern of 20 jumped up for 2025. Ironically, I see that same pattern on personnel. It went 14, up 14, then back 3. What's the explanation for that?
So let me, if I could touch on the contracted services and maybe add a little bit of additional explanation there. When we looked at our 24 budget, if we put ourselves back into the mindset that we had when we prepare our budget for 2024 would have been in July of 23. So at that time, the pandemic ending in May was very fresh. We were deliberately conservative with our 24 budget as we didn't know what our revenue was going to do in the next fiscal year. So we also were conservative on the expense side to make sure that we're as close to balanced as we could possibly be. As we saw the year go on, we interacted with the state. They put more funding into the mix. We were able to provide, frankly, a much needed boost to our provider network, particularly in a couple of codes where they were literally losing money as they were providing services. So there is a big jump there going into 25, but I think when comparing to 24, we have to look at where we were, and we didn't want to be in a Medicaid deficit position going into that year. So that's a little bit more context on that piece.
So when you say provider network, what's some of the examples of a provider network?
Sure, we have, our provider network does all kinds of services. So our biggest services are inpatient. So if we have someone in the hospital that they've reached that level, they're in a crisis situation, they're hospitalized for it, that's a very large expense for us. We have a lot of folks who are mentally ill or have developmental disabilities who are in group homes. That represents roughly $60 million of our budget, so that's a big piece, and it's an expensive service. We have other individuals who receive that service, but they receive it in the home or in the community, so we call it community living supports. That's also a really big portion of our budget. So it's helping those folks learn the skills to live within their mental illness or their disability. And then the last one being kind of day programs where folks can go and again learn those skills, interact with others, and be out in the community is another big portion of our provider network budget. We do not provide those services I just mentioned in-house with county staff.
And you lock them in by virtue of contractual services, and you're increasing the previous rate from 24 to 25 to lock them in. Is that what I'm hearing?
Correct. Many of our providers have been providers for decades even. And so as we've stated, their costs go up. They have trouble retaining staff. These jobs are really hard jobs, as you can imagine, and they tend to be lower paid. So we're trying to shore them up on that so they can attract staff and provide quality service to the people served in Macomb County. So.
Okay. The second part of the question, when I looked at total position headcount, it was 15.2, not changing for 2025. The personnel costs went up $14 million. Am I reading that right?
So we do have 15.2 in our substance use fund, but the bulk of our employees are in our mental health fund. So there's 347.6 in that fund as well. But to your point though, the FTEs are not going up from year to year. We have a 6% increase that I don't think we had in the 24 numbers because it was unknown at the time. We do have an additional 3% that we know now going into calendar 25. And then Tony, there was a couple other things you looked at as part of this number.
Yeah, one of the biggest things too is just our approach this year of fully funding every one of those positions to the maximum, with the thought being if there's a vacancy, knowing that we have challenges recruiting, anywhere we had a vacancy, we just budgeted at the top of that range. So there's some room there if we were able to recruit people at a lower range, obviously we'd bring them in, but what's reflected in this budget is those positions at the very top of each range. So that adds probably $6 million to this cost. Now, many of those may remain vacant, but we wanted to be sure the funding was in the budget.
And I'll add to that too, a lot of our open positions are therapists, psychiatrists. These are high-level positions with a lot of education and training. We're competing with even our own provider network in regards to how these services are provided. So there's a limited pool of those people. And we feel that if we have a good candidate, that's why we'll have to be closer to the top end of the range on an offer.
So the budget for 2024 being at 30 million for personnel, that was entirely spent?
So we have our 2023 actuals. It was, yeah, at least. We don't have that number right here, right now, but we can provide it.
How is it I have numbers they don't? Am I looking at E3? Is that the right page?
Yeah, if the question was, do we spend approximately 30 million, that's probably right in line. And we could bring the exact number, but it would be right in that general area. Because again, our positions were not full in actual, but we're fully staffing in the budget. So that is part of that variance.
And do you work with Martha T-Berry at providing services there at all?
I think we have some overlap with our OBER program.
They would be another one of our partners in the community. We don't necessarily provide direct services. We would have people there.
Services?
I'm sorry, I didn't hear you.
Would they be under contractual services?
No, we don't, but they would just be a community partner. We would serve the people that maybe live there, or they would refer to us and we would work with them.
Thank you. That's all I have, Chair.
And I just wanted to touch real quick when I said, we don't have our 24 projected number as a column on here, so that if that's of interest, we can provide that as well.
Thank you. One last question. Do you have a staff or multiple people working out of home on a regular basis?
At their homes?
Yes,
Yeah.
we have a hybrid workforce schedule.
Would you go to the microphone, please?
Sorry, we have a hybrid workforce schedule, so all of our individuals are community-based. So when I say even though they're allowed to work from home, we have a schedule that allows them to work from home or in the community. They're given credit either way. And again, many of our programs, we go to where the person is at. They don't necessarily come into the office where we reside.
Okay, that's just a question I'm gonna ask every budget person that appears at that podium. Because one of our departments has 70% of their people still working at home. And to me, that's just totally unacceptable. But in your case, with the uniqueness of the jobs that you perform, it's got a more regularity to it, so thank you. That's all I have, Chair.
Commissioner Brown.
Thank you. Thank you for the work you do. You're doing incredibly important work. And you've really come out during COVID about expanding the needs of mental health services, and it continues to this day through the other initiatives the county's doing. Part of the ability to, you're facing the same problem we are with trying to keep employees, attract employees, pay them what they should be paid. But you're limited. You're limited by the fact that you're in an organization with us. The county contributes every year about $4 million to their budget. we could have that $4 million back in our budget to fund things in our priorities that we need in our county to help out if they were spun off into an authority. I'd like to see you guys, we've talked about it before in the past, we've run into roadblocks, been a lot of time and money and energy spent studying, moving CMH to an authority. I was on the board, I was the lead commissioner when we created CMH back in the early 90s. And there was a lot of angst, a lot of gnashing of teeth when we did that because it was change. But it's proven to be a huge success. But the way they've managed mental health, community mental health across the state has changed. And most of the modern organizations are created authorities. Authorities, which means they're independent. They're spun off of the county. They're no longer part of our liability because there was a time when we had problems with the organization. This organization, they were looking at $20 million of the deficit that we might have had to pay as out of our general fund at a time when our budgets were very tight as well. Fortunately, the good management came in and you turned things around and it's very good. It's running fine now. But because it is running so fine now is the time to create an authority to spin them off so that they can absorb the costs that would be involved in that transition and not have us, the county, pay for it. If they were created an authority, they'd have the ability to fund the positions that they need at appropriate levels to attract the people they need, the professionals, the clinicians, the highly skilled positions. The director they just hired a new director. Director's paid $130,000 a year for all the things, all the responsibilities they have across this county with people that need them. Community mental health is a critical service that services families that are in crisis on a daily basis with all the stress that comes with. And they're in charge of managing it. They're doing a great job. I've been working with them since they were created back when I first was a commissioner 30-some years ago. And there's a lot of people they take care of, but they're strained because of the ability for them to operate the way they should be. Look at their fund balance, $48 million. They're not tight for money now, but they're limited. They're being restricted on what they can pay employees because of the system they're currently in. And I've talked to Commissioner Kraft about this, and I'm going to push with the administration once again, because we need cooperation from the administration to do this, is to spin them off into an authority and let them operate the way other modern community mental health systems have been. Because it's unacceptable. I mean, it's not unacceptable, but it could be so much more. It could be improved greatly. Services could be enhanced, and it'd be better for everyone along the way. And I know you agree to it because you guys put this study together. You spent a year. How many years, Commissioner Kraft? How many years did they spend? They spent a year going through all the hoops and all the jumping. Then you get to the end, and it was turned down. And I was involved in understanding some of the reasons, but we need to revisit it, is what I'm saying. So I'm going to be sending a letter shortly to the administration again, asking to reinitiate that discussion to try to create a spin off into an authority, because I think you could do more good in that form of setup than having to be part of the county organization. Because, yeah, we look at their budget, we approve it, but you see we only put in $4 million a year to a budget that's, many more times that size. And that's good for us too, because if things get going, they go sideways. And they're like Martha T. Berry. They're at the whims of whatever the state and the federal government are going to reimburse them on so many programs. The state decides to cut them out, or the federal government decides to cut them out. It falls on us to make up the difference. And we sometimes can't afford that. Times are good now, but times aren't always good. And it could be a problem. And what happens when there's a problem, when you can't provide services? Those families, young and old, who have relied on those services would be cut off. And who are they calling? They're calling the commissioner in the area that's they're conduit to government. And if we can't provide it, their families are dead, they're hurt in a desperate way. It affects people in a real way. And they're doing a great job. They've done a great job. They've turned the organization around. but to ensure that it continues so that we don't have a crisis in the future, creating a mental health authority is the way to go. And I advocate this board to take this up, and the chair will bring this forward, and we'll be hearing more about this as time goes on. But we'll avoid a huge problem if we don't. And you don't even have to speak, because I know you agree with it, because you've been advocating for it for a long time. But my commissioners aren't as familiar with that issue. Some of them aren't as familiar with it as some of us are. So we'll be bringing them up. And Madam Chair, if you could drop this on your agenda in the future as it's appropriate to discuss that, I'd appreciate it. We're in budget times now. You know, this is something the Board of Commissioners, I think, will want. And, you know, and we can hopefully develop an understanding with all parties, including the administration. They want the same things we do. They want to care, but they have legitimate reasons why it was a problem for them to go forward. But I think we can revisit it and try it again to find common ground to make this happen and make it be a reality so that everyone's a winner. And more importantly, secure for the long term the services that they provide. Because there's a whole wide range of services. And you can tell by the questions here, some of the commissioners aren't even familiar with all the things that you do, from substance abuse to mental health and everything in between, and how many clients they are. I have more group homes in my district than anywhere in the county. That's because I'm in a rural community. People don't like group homes in their community because there's a stigma attached. There's a lot of things why people are scared of it. So they're out in my neighborhood. And I know a lot of clients. I look after 2 individuals that I've seen it since they were small boys. Now they're grown men, but they're able to maintain their life and live independently through the help of the community mental health organization. And I've had those families' parents have passed away who are hoping that, you know, they were scared because what's to become of their children who have mental health issues after they're gone? Who's going to help them along? Community mental health is the one that puts the guardrails up and provides some support so they can live productive lives. And so I just can't understate it enough. That's all for now. But to be continued. But to be continued.
For now, Coach.
Thank you, Commissioner Brown. Commissioner Nard.
Well, most everybody asked the questions that I wanted to ask. I have a daughter that takes care of people that are mentally ill, and I even have she has a client that they're like family to us, and she's been taking care of them for years. She took care of the brother before he passed, and they're like in a trust, and their parents knew that they were going to be, you know, always need mental health services, and they set them up so that even now they're in their going on 70s now with the mind of a 13-year-old, but they're able to live on their own, and they still have their own house. And so, you know, you guys are really great, and I believe that you guys are taking care of them as well. So they asked all the things I wanted to ask, but one thing that me and my niece was talking about, she's a psychiatrist, and she wanted to know, do your type of organization do research? And the type of research she was speaking about, because I had to ask, wasn't for sure what she meant, was like, do you research like the type of services? So mental health with suicide, mental health with veterans, mental health with age groups. Do you do that? And she was asking that because she said that you can kind of determine how you're going to spend the money and where you're going to spend it, how you're spending it, even in the ages of the people that are needing mental health. Because she said she noticed that a lot of younger people are needing mental health since COVID because, you know, their parents passed away, and so now they find themselves at 16 and 17 adults now. So she was just wondering, do any of you have like a research that you do along with mental health?
It's a great question. Yes, we do. In the way that we do look at our analytics, we have HEDIS or health indicators that we look at, and we do look at indicators. As an example, you are correct. In the female population, 12 and older, suicide rates have gone up. Therefore, we as an organization need to address what are we doing to educate that community and support them. So I'm giving you that one simple example, but there's examples after examples after examples of that, of identifying specific populations. We also look at things like ethnicity and underserved populations and what prognosis they have and what challenges they're running into. And then we have specific performance metrics on focusing on addressing those gaps.
Wow. That's great. Thank you.
Yep, we also have evidence-based programs, and I will stop after this one, I promise, because we all could go on for hours and hours. We like what we do, that specifically are designed around that. It's like, what's the best way to serve a person who's in this exact diagnosis in order for them to best, most likely succeed?
Oh, wow, that's great. Thank you. Should be happy to hear.
Good.
Yes, yes.
All
Thank
right.
you, Chair.
Commissioner Kraft.
Thank you, Madam Chair. I just want to thank our team, Ken, Tony, Tracy, our entire staff. We really do have an incredible staff, and you've heard annually we're 40 vacancies. I mean, that's consistent. That was pre-COVID, during COVID, post-COVID. That's just where we're at. So what we're able to do with the staff that we have and the funding that we receive is just incredible. And I'm truly honored to be the chair of the board. Antoinette and I have seen these numbers constantly all throughout the year. We get a presentation every month. We are absolutely familiar with where we were, where we are, where we're headed. And one thing that was left out was, our savings, our reserves, our internal services fund, they're maxed out. We are not allowed to save any more money than we already are currently per state rules. We could save more if we had the rules tweaked a little bit, and we're working on the state with what we can keep and what we can't. But I mean, we're maxed out. We are doing what we should be doing. We are trying to help as many people as we can help. We have a mobile unit. I know we talked earlier about going to where the folks are. I mean, I have a mobile unit coming to an event in my district this Saturday morning, and that's available to any commissioner if there's any events going on in your communities to get the word out as to what we do. They're there for it. We have great staff that volunteer and show up and give their time on a Saturday morning in New Baltimore to come tell the folks about what we do and the services that we provide, because we are there to help. That's our mission. And we, like Ken mentioned, we do have giant billboards now. There's one on 94 Hall Road. They're all over the place. We do have an extensive marketing plan. Antoinette's been on it about our social media program and what we're doing, because we contract that out and trying to keep our contractors in line with what we're thinking and what we're seeing. So I can't say enough good things about our team and what we do, because it is tough work. It is very challenging. And the families that we treat, the people that we treat and see, I mean, what we're doing is so incredibly important. And we are seeing an uptick. I mean, since COVID, and it's just going to continue, because people are knowing that we exist. People are understanding that they have these issues and that they need some help, and we're there. So I cannot repeat myself enough as to how proud I am of our team and how proud I am to be on that board. So thank you all, and thank you, Madam Chair.
Thank you.
Thank you. Commissioner Romano.
Thank you, Chair. Let's give kudos where kudos should be given. And Commissioner Kraft, Commissioner Wallace, they're passionate about CMS. They really are. I mean, any questions asked, where it's going, where the money is at, ask Phil. He's got every penny down. And keep your hands off his fund balance. Whoever it is that tries to stick their hands on his fund balance is going to have to go fist to fist with Mr. Kraft over there. I just want to say, Steve, Phil, you and Anthony do a great job, honestly, and we need this. We need people like you in Macomb County, and we need people like you as a chair, because not only is it just something that you feel that you should be there, you're very active in it and you're very passionate about it. So as a commissioner, and I think all the commissioners, we thank you for that. That's all I have, Chair. Thank you.
Thank you, Commissioner Romano. So Commissioner Romano, are you suggesting that we all write our state senators and state reps and tell them to keep their money off of Phil's fund balance?
Yes,
All right.
absolutely.
If they answer.
Good luck with that.
Well, seeing no more speakers, all in favor? Any opposed?
Motion passes 12-0.
All right.
Thank you.
Thank you guys very much for coming out. Thank you. All right, and that has us move on to item number 7, which is public participation. At this time, anyone who wishes to speak will have a maximum of 3 minutes on any issue.
I think we missed something, didn't we?
What? I didn't vote together.
Oh, did you?
She put them both
Yeah.
together.
Sorry.
Oh, my bad.
BC wants to speak.
All right,
Again.
seeing no one for public participation, we'll close that. Commissioner comments. Anyone wish to speak at this time? And Commissioner Wallace.
Gosh. Okay. So I'm sure most of you know today is World Mental Health Day. So I just want to make sure you all are checking on yourselves, take some time out for you. As I'm sure, just like myself, I focus on like my husband, my kids, my cross country track team, my dog. But sometimes we just got to take a break from that and make sure that we are okay. Also, going back to what Phil said about our mental health team, they are always willing to educate our communities. On the 24th, not 25th, they are coming to Mount Clemens just to talk about why mental health is important, education on substance abuse, trauma, signs and symptoms, because like we said before, we do have an uptick in the homeless population, and our community leaders, business owners need to be educated in that area. So our lovely team is going to come and do just that, educate us. So last thing has nothing to do with mental health. You all got the email. It's almost time for us to go do this parade again. So I hope you get your gloves, meet you on Main Street, and we're going to walk right before Santa Claus comes out. So make sure you put that in your calendar. Thank you, Chair.
Commissioner Nard.
Yes, and Commissioner Wallace is right about far as mental health, coming from a family where one of our family members committed suicide, and at the time that they did this, they showed no symptoms at all, that everything was good in their life. They had financial wealth, everything was good, but for some reason they couldn't cope with whatever it was. And so it's really good to check on your loved ones. I could tell you a lot of stories about different things that you would be surprised. And then I just want everybody to think about the people that got hurt in North Carolina, and even there were some people that was hurt in Atlanta. I know that we don't deal with those type of storms, but I was in a frenzy for a while because I was talking with a friend, and then the phone went out and I didn't get a chance to hear from her for a while, but she is okay. But we just don't think about how devastating that is to lose everything. And so my friend was telling me, she said even some people lost the ashes of their family members and all of that in this thing, and that's devastating, and they're gonna probably need some mental health behind that. So just want us to kind of remember those people. And then I want to remember that as far as we have an election coming up next month, and I want us just to remember to pray that we have a free and fair election. If we're going to have any changes, we need to let the residents know, because I'm dealing right now with residents that are unhappy at the way things went in Warren, even though people say nothing happened, something happened. And when people cry and say something happened and we don't address it, then we get angry people. So we don't want angry people. We want to address their issues when something is happening to them and they say, hey, it's a problem. We as elected officials, as they said when we were in Traverse City, the FBI was speaking about, elections, especially when they have a federal election, that we should speak out if we see anything. And let's not say it's a conspiracy theory and saying all this stuff. It just makes people angry. And I've talked to people on both sides of the aisle, and they both agree that when things like that happen, you close polls or you move polls without telling people, you're going to get angry people. And I'm working now to get several people to go ahead and vote, because they don't even want to vote now. And these are people that normally vote absentees. But they're saying, what's the use if they just going to do stuff like that to people? What's the use? So let's just remember that we want everybody to participate in a free and fair election, no matter who they're going to vote for. Because at the end of the day, it's going to be the Congress that decides everything. So let's not just get so focused on who the president is, and let's remember our congresswomen and men and our senators, because they're the ones that can shut the thing down or not. So let's not forget that. And I'm teaching these young 18-year-olds that are going to be voting. I think I'm going to have a little bit over 75 of them. I'm praying that they go ahead and vote this year. So have a good evening. Thank you,
Commissioner. Commissioner Brown.
To Commissioner Wallace's point about taking care of our own mental health, I had an example of that today. Tonight we've got the Martha T. Barrett dinner. Some of us are attending that. I've got another function ahead of that. But I was offered 2 tickets to the Tigers.
Oh, where'd you go?
But because I'm responsible, I had to turn them down.
Commissioners, come on.
I had to turn them down.
Raffles.
What the heck?
Charity raffle.
Because I can get 2 tickets for us for $200 a piece. I don't know where they were at, but they were someplace.
Somebody throw something
And I
out.
had to tell her no. I said, but my mental health needs it. But the little guy on my shoulder says, "Oh, you got this meeting you can't go to." So I turned it down. So I'm still working at Commissioner Wallace to take care of me, but I'm taking care of everybody else first. So anyway, go Tigers. A long way to say go Tigers tonight.
Oh, yeah.
Thanks a lot. Thank you.
Well, seeing no other speaking.
Motion to adjourn.
All right, all in favor?
Aye.
Any opposed?
Motion passes 12 to 0.
We love to see